This is Dr. Gil Wilshire at Missouri Fertility. Today we're going to be discussing fertility preservation in men. Well, why is this important? Well, unfortunately, sometimes a guy's going about his life, feels a lump or a bump, neck, testes, something else is going wrong in his body, goes to a doctor and finds out he has cancer. Nowadays, the great news is most of these cancers are treatable, and in fact, many of them are curable. The downside, however, is if there's chemotherapy, surgery, or radiation involved, sometimes it can threaten a man's fertility, and sometimes it can totally wipe out sperm counts. Fortunately, the biology is on your side if you're a guy in this situation. First of all, most of these cancers are treatable, and men go into remission a large percentage of the time, particularly with the lymphomas. Secondly, sperm is a very easy cell to freeze. If you look at sperm cells under the microscope, they're tiny, they're dehydrated, they're compacted, and they're technically very easy to freeze. Scientists, veterinarians, doctors of all types have been able to freeze sperm for decades, and in fact the sperm wake up and are still biologically functional and are able to achieve pregnancies. Now, we need to do sperm collections before a guy starts chemotherapy or the surgery or the radiation. Now, obviously this involves a slight delay, but fortunately the delay is not long. If a guy is in my office and wants to have sperm preserved, the process is fairly easy. Number one, we do a blood test making sure the guy doesn't have any infectious diseases. We need to make sure the specimens do not have hepatitis viruses, HIV, or syphilis, because these tissues and specimens are going to be going into the lab with other people's tissues. That testing delays us 1 day. Generally, a guy can come into our office and make 2 or 3 collections in the course of a week. And once those sperm are frozen, they are safe, they're in the bank, and a guy can go about getting treatment and getting on with his life. Now, the best case scenario is a guy never has to use his specimens. In many cases, guys will have their sperm counts return, and after 6 months of sperm return, and if a guy's healthy in remission, his fertility can be excellent, and even if his sperm counts are lower, they can be used to establish pregnancies. It gives me great pleasure when we are able to discard frozen sperm specimens because the guy's fertility has returned. Other scenario is the guy's fertility is severely damaged and we still have these frozen specimens. You need to realize that these specimens do have sperm, but there's not large numbers of these sperm, and generally these sperm need to be used through a process called in vitro fertilization to establish pregnancies. Thank goodness IVF is very, very effective nowadays, so pregnancy rates are tremendous using those frozen sperm samples. So, I hope that explains how we preserve fertility in men. If you have any other questions, feel free to give us a call. For these cases, we work very rapidly, and if you call us or your oncologist calls us with your case, we can generally get you in real quick and get this process done and behind you so you can work on getting better. This is Dr. Wilshire at Missouri Fertility. I hope you found this video helpful. Please feel free to like us on Facebook, subscribe to us on YouTube, and follow us on Instagram.